Hi, I'm Lucas,
And I'm Brian.
and this is the Quacks Podcast. Hello, everybody. Welcome to the podcast. We have a special interview this week from Dr. Dejan, who works down at Healthy Habit, has a clinic, and we're going to be talking to him about a variety of different subjects. Brian sadly could not make it today, so it's just going to be us two. But anyway, how's it going?
It's going well, Lucas. Good to be back. Last time I was joining my partner there, Erin. You interviewed her the last time, so
Yeah, we talked to her about a lot of the basics of like naturopathy and what training you go through and stuff. And so maybe we could start off maybe by just giving you some of your background and what your training was to kind of remind listeners what happens there.
yeah. So after high school, I did a 4-year undergraduate degree in kinesiology. So human movement, aging, human performance, movement science, exercise physiology, like that type of stuff. 4 years of that. And that was in Canada, by the way, Windsor, Ontario. That was University of Windsor.
Nice.
Yeah, so that's where I was born and raised.
Okay, very cool.
And then,
But that's not where you're originally from, or
I was born in Windsor,
Oh,
Ontario.
okay.
Yeah,
Gotcha.
but my family came from Serbia in '89.
Gotcha. Okay.
89 from Belgrade. Belgrade, that's the capital of Serbia. They came there '89. I was born '91.
Okay.
So, and then born and raised in Windsor. That brought me to about 2013, 14. That's when I moved out to Arizona for medical school, and so I did 4 years of naturopathic medical school in Tempe, Arizona, Southwest College of Naturopathic Medicine.
Awesome. So what made you want to get into naturopathic medicine?
Well, I knew towards the end of high school, I decided I wanted to be a physician, but I thought there was only two types of medical school that you can go to. You can either become an osteopathic physician, a DO, or an MD, medical doctor. But then towards the end of my undergrad, I found out there was somebody else in my program that was going to medical school. I'm like, what type of doctor? She said, ND, naturopathic medical school. And I didn't even know that was an option. So that's the third way of becoming a primary care physician, is becoming an ND instead of an MD or a DO. And so I looked into it a little bit, and I saw that it's a legitimate 4-year accredited medical school. You have to do 2 sets of board exams. You get your license and you're eligible to practice medicine after.
Yeah.
So I'm like, okay, this is a legitimate medical school. But it was all focused on herbs, like botanical medicine, nutrition, lifestyle medicine, even physical medicine, like deep tissue work, chiropractic type medicine, acupuncture, traditional Chinese medicine, a lot of that. And so I'm like, wow, you can become a physician and actually get trained in these modalities. I'm like, it just makes sense, because I was already, at that time, I was diving into nutrition and mind, body, spirit medicine and exercise and things like meditation and different stretching, yoga type philosophies. And it plugged perfectly right into my undergraduate of kinesiology, like, because we were also learning about sports psychology in that program, and a lot of the mental health and physical medicine type of approach to health. So it naturally fit into what I was already studying and getting experience with and learning on the side in my own life. I'm like, wow, so I can combine all of this and actually become a licensed doctor. I'm like, let's do it. So I also did apply for DO school in Michigan State, in addition to naturopathic school. But I ended up taking the naturopathic route.
So you came out of naturopathic school and you got this clinic at Healthy Habit, Health Foods, which is on 7th Street in Bethany Home, if anybody wants to go check it out in Phoenix for our local listeners. And so you get to see customers like every single day and patients every single day that are coming in and asking you for a variety of different ailments and things. So what are people coming and asking you about? What are people interested in these days? What is their focus at? Are there any major trends you're seeing or anything like that?
A lot. Most of the time, definitely in the last half a year, for sure, the last 6-7 months, a lot of digestive issues, big time. I feel like gut health just continues to worsen and worsen and worsen overall as a population. So a lot of people are having digestive issues, from alternating between constipation and diarrhea, to having overgrowth of bad bacteria, to being on a variety of antibiotic courses, which destroy. It's like a bomb. It's like a gut bomb. When you take antibiotics, destroys a lot of the good bacteria in there. And to just eating all these processed foods and heavy animal protein foods with no fiber at all to match up with it. Just zero fiber foods, ultra processed foods, ultimately just destroying the gut. And so a lot of people are having issues from there. And then in addition to that would be mental health problems like stress, depression, anxiety, sleep issues, a lot of that. And then pain, for sure. Pain is a regular thing, a daily thing that people come in for.
Wow. So really like those three things.
Yeah. So digestive issues, mental health things, and that includes sleep. So anxiety, depression, sleep, emotional stuff, and then pain.
Okay.
Those are definitely the big three.
What are you finding that they end up picking up for this?
So a lot of probiotics. People are definitely gaining an interest in probiotics, which I think our radio show there at Healthy Habit has also helped raise the public awareness on how important our microbiome is. So then a lot more people have been hearing us on the radio talk about probiotics. So that, and then digestive enzymes, that's a big one too. And then just overall gut support. People will come in, and actually acid reflux is a big one, like heartburn. Actually, the other day I prescribed Swedish bitters for a lady who's having thyroid issues.
Really?
And
thyroid issues?
Yeah. So for those of you that don't know, Swedish bitters are basically a combination of, I think it's 12 or 14, somewhere around there, different herbs that have, it's a formula that's traditionally been used for gastrointestinal distress, just overall bloating, gas, irritable bowel type things, issues with bowel movements, anything gut related. Swedish bitters can just help soothe and relax that area. But it has traditionally been used in naturopathic medicine for hypothyroidism as well, Hashimoto's, which is autoimmune hypothyroid, and then just general hypothyroid, because it's calming down all that gastrointestinal distress and inflammation, and potentially relaxing the leaky gut, helping to maybe reduce some of that gut permeability, can therefore kind of indirectly help hypothyroid, because now you're going to have less of these foreign particles and toxins and all these different foreign antibodies leaking into the bloodstream, because the Swedish bitters are going to help heal up that gut. So that can help hypothyroid as well. And then for the pain, I've been pointing a lot of people towards curcumin or theracurmin, in general turmeric, but emphasizing the idea that the spice that you use on top of your food probably isn't going to be enough.
Probably not.
Probably not going to be enough.
Yeah.
You're going to have to use a lot of the actual food-based turmeric.
Yeah, probably more than what most people are willing to take.
I would definitely still use it on top of your eggs or on top of your avocado, or just, you can even put some in your smoothies.
Okay.
But I wouldn't leave it there expecting the pain relief. That's where the things like theracurmin come in, where it's like a potent extract.
Yeah.
So, and the thing that you should be looking for there is curcumin, like a curcumin extract, not just turmeric, because you want to have that potent extract that's standardized to a specific percentage of curcumin.
Yes.
So that you get the therapeutic pain relief. So
cool.
Yeah, that was digestive issues.
Yeah,
pain,
and then also mental issues.
mental health issues. A lot of people have reported benefit with melatonin, especially for sleep.
Okay.
But for, what's interesting, as you correct the gut health, mental health symptoms seem to improve. And I know you're very familiar with that by now with, the serotonin. Most of the serotonin's produced in our gut. So by cleaning up the gut health, a lot of people get mental health benefits, less depression, less anxiety, better sleep, less suicidal ideation, less ADHD symptoms, like all of these things, less bipolar. Some people don't even have to go on certain antidepressant medications after they get their gut health figured out.
Yeah, that's pretty cool. I mean, I remember back in the day when I would talk to people who had IBS, irritable bowel syndrome, like there weren't many people with IBS who were walking around super confident and, not having some kind of mental issue.
Absolutely.
Right?
That's such a good point. One of my former roommates, hopefully you won't be listening to this, but I won't use any names. I lived with 4 different people, so I'm not going to use a specific name. But this person was dealing with a lot of GI issues, and he never could go out. He can never, hey, you want to come hiking with us? No, he can never come. He's having this issue, or like he wouldn't want to go out and talk to people and meet different members of the opposite sex, talk to them, introduce himself. Like there was no confidence there, and there's a lot of emotional stuff going on, and it all starts with the gut. And it makes sense. I mean, if your stomach's inflamed, you're not in a good mood, right? If you get bloated every time you eat, and you're having irregular bowel movements, and you're having the bloating, it's not fun, right?
Yeah.
So it makes sense. But then you can support it with good brain nutrients like GABA. Even I'm a big fan of herbs. Like botanical medicine's always going to have a special part of my protocols and my research. It's so powerful because herbs have been around longer than humans. Like plants have been around and used as medicine for thousands of years. So if you can get good brain nutrients like bacopa, even ashwagandha is good for overall stress in the body. It also is very beneficial for the brain. Curcumin can also help with the brain. We talked about bacopa, but like gotu kola, ginkgo, all of these different brain nutrients, brain herbs. And I'm a fan of combining herbs. I like instead of just taking one. Everyone has their own preference when it comes to herbs, but I really like combining a variety of brain herbs together just because they work together. They have overlapping similar effects, but then each one brings something unique to the table. Lion's mane mushroom is fantastic for brain. It's really, all the mushrooms, but especially lion's mane is going to be the one for the focus and concentration and mood, versus like chaga is more for vigor and sexual performance and athleticism. Same with cordyceps. Those are a lot for recovery and stuff like that. But for brains especially, you're going to want to go with lion's mane mushroom. So that's some stuff. And I tell people when they come into the store, there's 100 different things we could do for mental health and gut health and pain. There's 200 different things I could throw at you, but we want to try and, I always like to streamline it for people. I think less is more when it comes to supplements. I'd rather have somebody take a handful of things, like three or four, like really high quality supplements instead of 10, or some people are on 20 different supplements.
Wow.
So simplifying it as much as possible is the goal always.
So yeah, speaking of patients, you were telling me a little bit about some patients you had, or one patient, who you're helping with their cancer therapy. And I was wondering if you could kind of tell us a little bit about that story you told me. I think the guy you were telling us about had stage 4 lung cancer. And just could you tell us a little bit about what you're doing with him and what he's experiencing?
Yeah. And again, so I am a primary care naturopathic physician, so I'm not an oncologist. So for those of you listening, I don't want to get the wrong idea that I'm a cancer physician. That's not my specialty. And we try, and I am working with several cancer patients.
Okay, great.
But we do establish right at the beginning that I am not their primary oncologist, that they're continuing to work with an oncologist for ongoing imaging, for ongoing monitoring of their progress and scans to assess where they're at. Has the tumor metastasized? Has it shrunk? Has it grown? Has it stayed the same? So they're still being monitored by their oncologist. And then what I do with them is I provide natural health support, get them on the right nutrients, get them on the right supplements, do IV vitamin C IV, like high dose. We're talking 75 grams to 100 grams.
And is that a week, a month, or?
And it depends. In the case of this guy that you brought up, this patient who is stage 4, for him we've been doing 3 days a week. He's been
3 days a week, 75 grams of vitamin C.
Yep.
That is a lot of vitamin C.
Yep.
Yeah.
Absolutely safe. The research is pretty in depth. I mean, there could always be room for more studies, but at the end of the day, there isn't a massive $1 million pool of funding for IV vitamin C high dose research in oncology patients. It's very good luck.
It's so cheap, right? Vitamin C is so cheap. Yeah.
So, but from the research that we do have on it, great results, very safe. And the idea there is you're doing it IV because a lot of people have gut inflammation, as we just talked about, especially people with cancer. Their immune system is very low. Overall, their system is not firing appropriately. It doesn't have that good functioning overall, especially the gut. And so with the gut, you're only able to absorb, they say, 250 to 300 milligrams roughly of vitamin C orally per hour or so, per every 2 hours. The rest we clear out, especially in people that are having gut inflammation. I would argue it's even lower than that. I would argue it's even less than that. So the beauty of IV vitamin C is that you're able to bypass that gut. And so you're able to get right into the bloodstream with these nutrients. And so then it goes right away. It's available to the entire system. Whereas if you take things orally, you can't high dose it, especially with vitamin C. So that's the benefit there. And most of the research that we do have on high dose vitamin C IVs is done on chemotherapy patients. So patients who are doing the standard of care, chemo, radiation, potentially surgery, and on the side, they're getting these high dose vitamin C IVs. And significant reduction in side effects that chemo normally produces, like nausea, vomiting, impaired immune system, hair loss, bone pain, all these different, there's hundreds of different toxic effects of chemo and radiation.
Yeah.
And so vitamin C has been shown in the research to help with some of those common side effects that usually come from a result of chemo. So
cool. So it's you're doing the high dose vitamin C.
Yep.
And then what else is he getting?
Yeah, so the first thing we started before even doing the IVs is talked about nutrition. Nutrition is so important because we're doing it all day. We're eating all day. And that's what's giving your body, the information for healing, for everything, for liver support. If you have a tumor in the body, some people have multiple tumors. You're going to want to make sure that liver has optimal nutrition to be able to detoxify all these byproducts from the tumor and from the cancer, the waste that it produces. Cancer cells also produce metabolic waste that has to be cleared out and processed by the body. So that's where the liver comes in, and then that's where you got to get them on the right nutrition to be able to support things like the liver and make sure that the cells are getting the vitamins and the minerals that they need. And so definitely we place a heavy emphasis on nutrition. And then the third major thing that we talk about is supplements. And it's not only things like vitamins, but a lot of it is, like, for example, we just introduced wheatgrass juice powder to his protocol. The idea there is 2 teaspoons of this raw organic juice powder that we actually have at Healthy Habit is equivalent to about a 12 by 24 inch rack of wheatgrass. Imagine juicing fresh organic wheatgrass, a big tray. That you get all of that juice in just 2 teaspoons of this concentrated powder. So we added that to his protocol. And then things like DIM, like DIM, which is in the cruciferous vegetables, extremely anti-cancer, very therapeutic. And then Montana U-tip, which are you familiar with that plant?
A little bit. Maybe you could talk a little bit more about it.
Yeah, so the Montana U plant, that's the name of the plant. It's the U-tip tree, basically. Chemotherapy companies have been using the taxanes that's found in that plant for about 100 years now to produce chemotherapeutic drugs.
Interesting. So it's kind of like a natural chemotherapy?
Absolutely. So instead, what we have in the store, and that must be the only store in the valley that carries it.
Yeah, I don't know if
I'm pretty sure
anywhere else I've seen the Mountain
And
U.
we've had Russ, the leader there behind the company, the man running the show there. He's been on the radio show several times. Extremely nice guy. But yeah, they've had that company up there for decades. And so it's interesting, the chemo or the nutrient in that plant that's actually protective against cancer is called the taxane, Taxane. So the taxanes in this plant, like I said earlier, they've been extracted and been highly refined and processed and concentrated with all these other chemicals added to make some of these chemotherapy drugs. And it's so funny. They used to go up and literally harvest it from that Montana U plant. And instead we get to, and that's where all the side effects come from, because you're taking that highly extracted, concentrated form, right? Versus when you consume the powder or the tincture that we have there in the store, you're taking the entire plant as a whole, and like the leaves and the twigs, and it's ground up into a powder. So it's not just the taxanes in there. Now you're getting that whole plant as an entire unit instead of like a highly processed individual unit. And that's where the problems come from, and that's why I suggest people to go with whole food supplements instead of like just vitamin A. Try to get it from good organic pasture-raised egg yolk, or carrot juice, or sweet potatoes, or yams.
Yeah, you get all the cofactors
instead of just highly concentrated vitamin A. And there's actually research that for example, calcium supplements. If you take a lot of calcium supplements at high doses for a prolonged period of time, you can actually increase the risk of fractures.
Really?
And hardening of the arteries and cardiovascular events like stroke and heart attacks and high blood pressure, atherosclerosis. Because if you take such a high dose of pure calcium instead of getting it from green leafies, or avocado has calcium, oranges, there's all these food sources of calcium. We can easily meet our daily calcium needs through food.
Okay.
And so that's the main issue. When you take highly concentrated single nutrients out of foods and plants, that's when problems happen. It's different when we're talking about herbs, because with herbs you're actually taking the plant and just soaking it in. Typically it's cane alcohol.
Yeah.
But it's not like we're just taking one single component out of those herbs. We're soaking it in that liquid and taking all of it. So yeah, we've been doing the IV vitamin C's, high dose. Talked about nutrition. Definitely been covering supplements. Another thing in supplements that we've been doing is mushrooms. So things like the wheatgrass juice powder, Montana U powder, and then we have them on a nice Soul Array 8 mushroom blend, which is 250 milligrams of equal parts
of all the different mushrooms. Nice.
A big fan of that. I mean, I was using that myself too. My morning coffee, you take a scoop in there, put it in your coffee or smoothie.
Really?
Yeah. Why not? Why not stay ahead of the curve? That just reminded me. Like most people, they wait until they get sick, or they wait until their health is completely fell apart and something really bad is going on before they start getting into health and talking to a naturopathic physician or somebody who, someone who understands health, versus staying ahead of the curve. And I mean, it's worth it. You feel better.
Yeah.
You're getting in. Mushrooms are even older than plants. Mushrooms are technically a fungus. So that's, most people think that they're a plant, but they're not. They're a fungus. And so fungi, there's a theory that fungi were the first basically living entity on this earth, before plants, before humans, before animals. So
yeah,
mushrooms are ancient. And so definitely we put that part of his protocol. And again, I like the 8 mushroom blend instead of focusing on just one particular mushroom, because they all bring their own immune enhancing benefits to the table. Like mushrooms by default are good for the immune system.
Okay, so
we have them on a variety of things.
Yeah, you've got them on a lot of different stuff.
That's what it takes.
What is he reporting? What is he experiencing?
I'm glad you brought that up. Everything has been improving. He's been improving in 15 different parameters here. So with lung cancer, what happens is you get wheezing. You get shortness of breath, a lot of coughing. Some people even cough out blood. One very common thing among people that have lung cancer is they can't take a deep breath without bursting out in a cough.
And was this guy a smoker, just real quick?
He was.
Okay.
Yeah,
gotcha.
But he discontinued smoking about a year ago.
Okay.
Yeah. Right. Almost a year now. So
good
question.
Yeah, see what it gets him, right?
Maybe 80 to 90% of lung cancers are caused by smoking.
Okay.
There is still 10% that have never touched a cigarette in their life. Commonly in those people, it's asbestos. How do you say asbestos?
Yeah, asbestos.
Asbestos.
Yeah.
Or people that work, they do the, like they work on the streets, like they're constantly breathing in all the cement and construction.
Yeah.
So a lot of them will also, but 10% of the time.
Okay.
Not as common. So yeah, definitely a smoker.
So he was having all these symptoms, all these things that he was.
Yeah, he used to be in a wheelchair. Yeah, now he's walking. He's losing weight. He's able to take deep breaths now without bursting out in a long duration cough. He's not wheezing anymore. He's not having shortness of breath anymore. He's been losing fat, like he's been losing healthy weight. Instead of what happens in chemotherapy. Most people are familiar with what chemotherapy patients look like.
Yeah, you lose all your muscles.
You lose everything. You lose your hair, your eyebrows, your appetite.
So is he doing chemotherapy, or he opted
out of it? Yeah.
Okay, that's kind of a big deal.
So it is a big deal. Yeah, they had him scheduled to come in and get a port. They put that right, in the region of the heart, and he actually showed up to the hospital that day, and it literally took the very last second. He's like, "Nope, I'm not doing this." He told the nurse there, the head nurse, he's like, "I'm not doing it. I'll pay for the visit if I have to, but I just decided I'm not following through with this." He had like an epiphany. He's just like, "That's it." It's scary. I mean, it's
That's kind
I
of,
wouldn't do it. I'm going on the air here. I wouldn't do it. So
you wouldn't do chemo, or you
would not do that if it ever, God forbid, if that ever even.
Yeah, so you'd opt out of chemo.
Absolutely.
Okay, gotcha.
No doubt about it.
Yeah, I mean that's a really big decision.
It's a fear-based thing that they're putting into the public. You have to do this, and it's the standard of care.
Yeah.
So then people think that literally is what has to happen, or else there's no way I can survive.
Yeah, I mean it's a really tough decision because, I mean, I just read an article that a lot of times, you know, we're getting very aggressive in our screening for cancers. All, you know, the colonoscopies and the CT scan, all that. We're getting very aggressive in screening for them, and a lot of times these little cancers sometimes go, and I'm not saying this guy has a little cancer, stage 4 is not little, but a lot of times these little cancers go away, you know, they disappear. And I know prostate cancer was one that used to be treated all the time, where now it's like, you just shouldn't even treat that. I mean, it's going to kill like 2% of people. It's not even worth it. That number might be wrong. And so it's a difficult decision. On the other hand, you know, we did systemic enzymes last week, like Wobenzyme and stuff, and they did a study where they compared Wobenzyme to cancer therapy for pancreatic cancer, and the people who did the cancer therapy for pancreatic cancer lived much longer than the Wobenzyme. They all died. Most of them died, all except like a couple. But the people on the chemotherapy lived longer, and so there is a decision there. I mean, I know for myself, I would probably not go the chemo route. But it is a difficult decision.
It is difficult.
Real quick, before we move on from the subject, you said you had a few people who you were doing cancer therapy and stuff for. Can you give us just like a real brief on what's going on with the other 2 people, like why they, you know, what cancer they have, what they're all that stuff?
Yeah, and the first gentleman that we talked about there, he's been with me for a couple months now. But the newest person that I just established care with, she's a female, 52-year-old female, who has, they said, it's been very unclear to her. The communication between the oncologist and her have not been very black and white. It's been very confusing for her. She doesn't exactly know 100% what it is, but what she thinks is going on is stage 2 cervical cancer there. Okay. She did bring in a lot of the imaging and things that they did, but nowhere does it exactly stay stage 2. But we do know it's cancer of the cervix. Okay. I don't exactly know the stage. She said it was stage 2, but it's definitely cervical cancer that we're dealing with. And that's very common. Again, that's actually one of the most common cancers among women, and it does typically present in that age, like 48 to early 50s.
So she came in. Is she opting for chemotherapy and combining it with what you're going to offer?
She also opted out.
She opted out of chemo. So, and you're going to do something very similar that you're doing with the gentleman.
I am for sure planning to do high dose vitamin C IVs. I mean, they've been doing it for a while now, especially in Germany, Europe, Switzerland, eastern part of the world. They've been doing that. And it just has such great results that like it makes sense to at least have that as part of the protocol. Yeah. To such a rampant boost in the immune system. And what the theory there is that in people with cancer, they have exceptionally low levels of vitamin C in their tissues, like very low levels. And so you want to supersaturate those tissues, especially the cancerous tumors. When you do IV vitamin C, they especially target the tumor cells. So what happens is the vitamin C, not that normal healthy cells won't also get some of the vitamin C, but a lot of it will preferentially go to the tumor cells. It will soak it up, and they can't survive in a vitamin C rich environment. So you're basically starving the tumor cells when you do IV vitamin C. Okay, so that's the theory there. So definitely you're going to have that.
You're going to follow up with these guys for, however long it takes, basically?
Basically, yeah. And most people, when it comes to cancer, and we're doing high-dose vitamin C IVs, it does take about 10 to 15 different sessions, usually. It's not like one. You don't just do one vitamin C IV.
Yeah, I'm really curious about the guy with the stage 4 lung cancer, because it sounds like he's, being well treated.
It's really amazing. Like, I was shocked.
Yeah, and it sounds like he's doing a good test of like, no, I'm opting out of this and I'm trying this, and we get to see, how that works for him. So I think that's pretty cool.
I've been telling both of these patients that we're talking about here, I've been told both of them that cancer is basically, you can put a cancer, aka, or cancer also known as improper lifestyle, or cancer, aka something's wrong with the lifestyle, and they just use that word cancer to slap it on you, and then that's when the fear comes in, as if there's nothing you could do to it, as if it's such a mystery for why it's there. Okay, let's take a step back and look at, what are you eating? Are you moving? Are you sweating regularly? That's another thing I didn't even talk about. I've actually prescribed sauna therapy for both patients, to be honest. Not even just them, but I try to incorporate sauna therapy into a lot of the patients that I work with. Because you know why? Because no one's sweating anymore. Mm-hmm. Most people just don't sweat, and we're all guilty of it. I mean, it takes work to either get in a sauna or do the exercise or go outside for a run or, something to promote that sweating response.
Yeah.
But it's so important because it's one of the 4 routes of elimination. In naturopathic care, we talk about 4 emunctories. And an emunctory is one of the routes of elimination for our body. So the urine, the feces, sweat, and then the air that you breathe out. Most people don't know that. Every time you exhale, you're breathing out toxins. Some people, you can smell it on their breath, right? But right? But so there are certain levels, not as much as what's released in the urine, feces, and through the sweat, especially the sweat, because it's our largest organ. The skin is our largest organ. A lot of people don't know that.
Yeah.
They think about the bowels, they think about the liver, stomach, brain, but the skin is by far, if we're talking about surface area, the largest organ. And the skin is highly porous, meaning it has all these tiny little microscopic holes in the skin that is designed for us to sweat, right? And a great deal of toxins are actually eliminated through the sweat. And I use the word toxins. It's such a trendy word now.
Totally.
Toxins, detox.
Yeah, I know.
So I'm using that as a very umbrella term for a variety of toxins, including metabolic waste products, as we talked about, carbon dioxide, which a lot of that comes out through exhalation. You want to optimize those and that's also why I get, especially the cancer patients, I get them on a high fiber diet, because we got to get that elimination down. We got to be eliminating and moving things along that digestive tract. That the last thing we need is for things to get backed up in the intestines and cause a whole nother issue, in addition to that tumor in the body. Now we have this hardening of and decaying and rotting of this food in the intestines that just sits there, and eventually that can start creating the leaky gut. So some of that spills into the bloodstream, can cause autoimmune issues, cause all these different issues. So definitely I get almost all of my patients on a high fiber diet, extremely important. And fiber is actually very important for detoxification, since we're on that topic. As fiber moves through the bowels, it's actually pulling different waste products into the fiber, into that bolus, so that when we eliminate it, we're detoxing even through the bowels. So fiber is so crucial, and 95% of Americans do not get enough fiber. 95% of Americans. So
yeah, that's a lot.
It's key.
So we've been talking a little bit about cancer. Are there any protocols that you like for autoimmunity or heart disease or obesity that maybe you could kind of touch on a little bit?
Yeah, well, you mentioned heart disease, obesity, and autoimmune disease. Yeah, the common thing among all 3 of those, and like I said, we're always looking for why are these things happening. We're like detectives. We're like naturopathic detectives trying to figure out, okay, why are these things happening? If you think of a plant or a tree, if you were to pull it out of the ground, you see all these different roots, right? There's all these. It's not just one root that contributes to the growth of a plant or a tree, right? There's all these different roots. Same thing with human health. So one of the major common root causes of those 3 conditions, autoimmune disease, cancer, and obesity, is inflammation, chronic inflammation in the system. Very neglected in conventional medicine. It's not being talked about enough. So chronic inflammation is so problematic, and there's many ways to get that inflammation under control. In the case of heart disease, the inflammation is happening in the arteries and around the heart, and in the capillaries and the arterioles, and all those different vessels in the body. They're inflamed. Yeah. Especially the major arteries that are exiting and entering the heart. That's what's going on there. And then when you're under a chronic state of inflammation, the body's stressed. The body thinks it's in starvation, or it thinks something is going wrong. It's in that fight or flight mode. And so what happens in that case, the body tends to hold on to fat and weight. It doesn't want to let go of it. So that can contribute to obesity. And then for autoimmune disease, again, the inflammation, but this time we're talking about inside of the gut. And again, that can, as we talked about earlier with the hypothyroid and the Swedish bitters, if you're having that gut inflammation for such a long period of time, you can get leaky gut. You can get opening up of those different, they're like little doors essentially in the gut, in the mucosa of the gut wall. It's a very thin lining of the gut. It's 1 cell thick.
Yeah.
The gut lining, intestines, stomach, especially the intestines and both small and large intestines. They're very, very thin gut linings, so that can easily get inflamed. It's interesting. The food that travels through the gut is actually still in the outside environment. It's still technically not in the body. You know what I mean? You've heard that?
I know what you mean. You're like a tube. You're a big tube from your mouth to your butt.
Yeah.
Yeah. That's
so technically anything that's traveling down through the intestines and that gastrointestinal tract is part of the outside world until it gets absorbed through that very thin 1 cell thick lining of the gut into the bloodstream. Then it's technically in the body. So that's pretty interesting. We have direct contact with the external environment through our gut.
Yeah.
So it's very easy for that gut to get inflamed. And what's very interesting is starting at about early 70s, I think it was like 75 and onwards, where they started freely using Roundup in agriculture. The number 1 active ingredient in Roundup is glyphosate. A lot of hundreds of studies have been done at this point, showing the link between glyphosate, Roundup use, and chronic inflammation, cancers, heart disease, autoimmune issues, ADHD in children, like all of these conditions that are so prevalent in society, depression, mental health issues, all of it with that root cause of inflammation. What's causing that inflammation all of a sudden is this spraying of these crops that they've never done before the 70s or late 60s. I don't know the exact date there, but they had never used this before. And a lot of people are blaming just the animal products, like the hardcore vegans.
Yeah.
Oh, it's the animal products that are the cause of the disease. And I mean, that's we're missing the elephant in the room, which is, 2 things. The spraying of the crops with Roundup. Number 2 is the highly processed sugary foods. Those are the elephants in the room. Those are the big ones. Because we've always eaten animal products. They came later.
It's tough because it's like I've skipped from community to community in the natural world that has blamed all of the ailments that we have on something or other.
Sure.
And it's like we've got Roundup is one of them. You know, there's the heavy metal group there, and it's so funny. It's just like it's like it all started in the 70s. It seems like that's like when that's when things started to go downhill. Yeah. And a lot of things were introduced in the 70s, including Roundup. And so I tend to be on that train as well, that Roundup, we should avoid it as much as possible by eating organic.
Yeah.
But it's so difficult to avoid it. It's hard in America because everything is just doused in that stuff.
Well, apparently it even rains some of these pesticides.
Oh, really? It gets absorbed into the atmosphere.
Because it's in the groundwater, right? Oh, so man. That gets evaporated. And then at the end of the day, it's like, you ever watch the movie Bubble Boy?
I don't, with Jake Gyllenhaal?
Yeah.
I don't think I ever did, no.
So you can easily go down that rabbit hole where basically the idea there is he lives in a bubble his entire life. His parents put him in there right at birth.
Okay, yeah.
And, he can't touch anything. He can't shake people's hands. He has to use these artificial hands that he puts and shakes, You can easily go down that rabbit hole and not ever want to leave your house because of, you're afraid of all these different... You got to live at some point, right? But that's where we do our best, choosing the organic foods, trying to regularly use liver support enzymes and eat clean, whole foods that are rich in nutrients, that have a variety of vitamins, minerals, antioxidants, anti-inflammatory agents.
Yeah, what do you like for supplements? What do you take?
Definitely an omega. I like a good algae supplement, EPA DHA combination.
Cool.
I like to regularly have some type of an adaptogen handy. Like lately, I've been doing echinacea, partly because I get free supplements sometimes from the store. But no.
Yeah,
that helps. No. But I like mushrooms. Like I love mushrooms. I took a break this past couple months, but I just finished a like one of those boxes of the 8 mushroom blend from Solar Ray.
Do you notice anything taking them, or do you feel better?
I mean, I just continue to feel good.
Okay.
So, you know, I never had any debilitating health conditions or diseases yet in my life, knock on wood. I do feel better now than when I was 15 and like when I was in my youth and early teens and stuff. I definitely, no doubt about it, I feel better now, especially like now compared to when I was in high school. Like by far, day and night difference. I had acne all over my face. I had gas, bloating. I would always get injured on the basketball court and regularly sprain my ankle. I wasn't, like, I didn't feel strong and healthy, and I would always have these abdominal issues. Like, I'm convinced now it was some level of, like, IBS stuff.
Okay.
So I was always dealing with certain things. I just didn't feel good. You know?
So it doesn't sound like you take too much.
Yeah, and a lot of water. I look at water as a supplement. Like,
really?
Green juices. We've been doing a lot of fresh juicing using an Omega juicer, like the slow masticating ones.
Oh, wow. Aren't those pretty pricey?
They are. I don't know. We got one for like 200, just under 200.
Not too bad.
And no, it paid off already. Like, you get very good, clean juice. You want a slow masticating one to get most of the nutrients out of there because it squeezes it. Like, there's extra pressure in there. So I view green juices, and when you do juicing, you definitely want to make sure it's vegetable juices. And if you're going to do fruit juices, make sure it's like a green apple because they're a lot lower on the GI, like glycemic index scale.
Yeah.
And lemons and limes, those are really good juices too. But for the most part, keep it to celery, cucumber, kale, wheatgrass, red leaf lettuce, parsley, cilantro. Keep it to the green vegetables as much as you can. Ginger's a really great thing to juice.
Yeah, spicy.
Oh yeah, really good.
Yeah.
I was doing NAC. I just ran out of NAC from Premier Labs, Premier Research. I just started taking NAC just because there's a lot of good research behind NAC. It's one of the best research supplements.
Really?
NAC has a lot of fantastic research. Why? For liver support, detoxification. It really helps in producing more glutathione in the body. You might be interested in that one.
Yep.
In addition to the one you're already doing. NAC and vitamin C work together to produce more glutathione in the body.
For me, NAC just makes me so angry. I have no idea why, but I take NAC and I just become a rage monster. But it doesn't happen with glutathione, so I can take glutathione. But for some reason, NAC is not good for my system. I don't know why.
Note to self. Yeah, I'll keep that in mind.
Yeah, if you see me really pissed off.
Did you take NAC, Lucas?
Yeah, dude. How much NAC are you on? Okay, so we're kind of running out of time, so... just real quick,
flies by.
It does fly by.
It's crazy.
You're going to be a radio show host coming up here.
What do you think? Am I doing good on here?
November? Oh, dude, your voice is bomb.
Really?
I could go to sleep to
Look
your
at
voice,
that. Dude. Appreciate that.
You could just read something. I don't know. Read something. It would be like a lullaby. You have a very
I'll keep that in mind.
like melodic, calming voice. I think you're going to be great at it.
Appreciate that.
But
bro.
what is? I mean, do you have an idea of what you're going to do on it, or what's the format of it? What's the station?
100%. Yeah, that's a very valid question. Well, it is going to continue to be. It's Healthy Habits radio show. Like, it's
okay.
So just to clarify that, the clinic that I work in is Healthy Habit Medical Center, and it's located inside of Healthy Habit Health Food Store.
Yeah.
So the health food store has been an entity for the past 20, 30 years. I think 20 plus years now. It's had 4 owners. I think this is the third or fourth owner now. Family-owned health food store. And they wanted to put a clinic in the store because a lot of the customers were looking for a naturopath. Some people were bringing in their labs, and I think we might have talked about this a little bit when Aaron was on.
When we did, I think. Yeah.
So they're like, "Hey, why don't we just put a clinic in the store?" And then that's how we connected. And
okay.
So that's what brings us. So we are located in the store, but the radio show, it's a separate thing. It's not for our business necessarily. It's for Healthy Habit Radio, for the health food store.
Okay.
So we're going to be continuing basically what Jen and Jamie have been doing. We're going to have guests on. Yeah. We're going to be doing interviews. We're going to be talking about products in the store. And some days when we don't have a guest on, we'll just talk about different things that we think is important or interesting or new discoveries that we just came across in the literature. If you come across something that you think is necessary, it would be good, tell me. We can talk about that. So yeah, sometimes we're going to talk about different things that we're doing in the clinic.
Okay.
like different things that we're doing with patients. Talk about the autoimmune or obesity. Like talk about the common problems that are going on in society and where we can start and what we can do for those different things. So
okay, great.
Yeah, we'll be mixing it up. It's going to be 1100 a.m.
1100 on an AM station.
AM, yeah,
at
it's KFNX.
KFNX. What time?
9 to 10 a.m.
9 to 10.
Monday to Friday.
Monday through Friday. Okay.
Yeah.
And you're going to start in November.
Yes, sir. Yeah,
All
November
right.
4th is the first day. And we've been on. Like I was on today, actually. Today, 9 to 9:30. I was on. They didn't have a guest scheduled, so I hopped on there. And
Nice.
I think I'll be on again. Actually, let me see. But do you listen to the show?
Sometimes.
Okay.
Yeah, I'm
Just when I'm on, right?
Yeah. Yeah. I'll listen, and I've been on there a couple times for some of the brands I work for, so I've listened then, but usually I'm listening to podcasts or whatever in my car.
Sure.
You know?
So I was on today, and you can listen to the replay on that one. That should be up tomorrow morning. And then again this Friday, the 25th, and then Monday and Tuesday, actually. So October 28th, 29th, and 25th here this Friday. And again, that's 9 to 10 a.m., 1100 a.m.
Cool.
So yeah, it's been fun.
That's great, man. Good luck. I hope you
Thank
do
you.
well, and I hope the show just gains in popularity and takes off and,
I appreciate
and
it.
does amazing. Because I think you definitely could. You've got the good voice, and you've got
Thanks, man.
so much stuff in your brain. You
Yeah.
can just talk,
Yeah, it
so.
goes on. And I think Erin, we're gonna do a good job together. Like she brings things to the table that I'll forget to touch on,
Yeah.
and vice versa. Like,
Yeah.
I think it's good to have that male-female balance. She does a lot of the women's health in the clinic, and I'm doing a lot of the men's health and pain management. And so I think it's going to be a good blend. I think it's going to be a good mix.
Sweet.
Yeah.
Well, that's all I got.
right,
If is there anything
Until
else you
next
want to? Yeah, is there anything else you want to cover before we're done?
Increase your fiber intake and remove or drastically reduce highly processed sugary foods. So
Okay.
But yeah,
All
man,
right,
I'd
man.
like to be on again, dude.
Yeah, dude, this
Yeah,
was
that'd be
fun.
fun.
This was a
Part
lot of
2?
fun. Yep, part 2. Well, thanks so much for coming on, Dr.
good.
Dejan.
My pleasure.
Yep, have a good one, man. Be well.